This 1927 portrait of a nurse and patient looks routine until you notice the clipboard. The photograph seemed unremarkable at first. A crisp white uniform, a woman recovering in clean sheets, the kind of image hospitals used to show they were modern and compassionate. Until Dr. Rebecca Chen found herself staring at it for the third hour in a row, unable to look away from what was resting at the foot of that bed. Chen is a medical historian specializing in early 20th century hospital records. She works in the basement archive of a major Baltimore medical institution, a place where file boxes still arrive from shuttered wards and demolished buildings. Most days she catalogs surgical logs and pharmacy inventories. But in February of last year, a facilities crew clearing out storage in an old nursing school dormitory sent down 12 boxes of promotional photographs from the 1920s. The images were meant for newspapers and fundraising brochures, proud nurses standing beside gleaming equipment, physicians in white coats posing with grateful families, progress on display. This particular photograph showed a nurse, mid-30s, standing beside a hospital bed in what appeared to be a maternity ward. The patient was a young woman, perhaps early 20s, propped up on pillows. Her face showed exhaustion, but not distress. One hand rested on the white coverlet. The nurse's expression was calm, professional. A clipboard lay at the foot of the bed, angled just slightly toward the camera. The image had been staged carefully. Everything clean, everything orderly. The kind of photograph that said, "Trust us with your care." Chen almost moved past it, but something about the clipboard kept pulling her attention back. She magnified the scan on her monitor. The board held several sheets of paper, and the top sheet bore a stamp in the upper right corner. Most of it was obscured by the angle in the paper's fold, but 3 words were visible in block letters. Research subject protocol, not patient, not admission form, research subject. Chen sat back in her chair. In 12 years of working with medical archives, she had seen thousands of hospital photographs. Promotional images were always staged, always optimistic, always designed to project competence. But they were also usually honest in their way. A surgery photo showed surgery. A nursery photo showed the nursery. This photograph, taken to show compassionate patient care, appeared to have accidentally revealed something else entirely. She printed the image, pulled out her magnifying loupe, and looked again at the young woman's face. The exhaustion was still there. But now, Chen wondered if what she had read as recovery was something closer to resignation. Chen had spent years studying how hospitals documented themselves. She knew that institutions were careful about their public image, especially in the 1920s when modern medicine was still proving itself to a skeptical public. Hospitals competed for patients, for donors, for prestige. They hired photographers and public relations staff. They published newsletters and hosted tours. The photographs from this era were not casual snapshots. They were constructed arguments. This hospital is clean. These nurses are trained. These patients are grateful. Trust us. But archives also taught her that institutions make mistakes. A caption gets written carelessly. A file gets misfiled. Someone includes the wrong version of a document in a press packet. Small cracks in the official story. And when those cracks appear in visual records, they can reveal entire hidden systems operating just out of frame. She turned the print over. On the back, written in pencil, Ward D, April 1927 for annual report. Below that, a stamp from a commercial photography studio downtown, Hartman & Sons. And below that, a number written in ink, 47F. Chen pulled out her laptop and opened the hospital's digital finding aid. Ward D in 1927 had been an obstetrics ward, primarily serving low-income patients. Many were referred through the city's charity system. The ward had a good reputation at the time, modern for its era, though the records showed high patient turnover and frequent complications, nothing unusual for a public hospital in that period. But the designation 47F was odd. Medical record numbers in this hospital's system from that era usually began with the year, followed by a patient's surname initial. 47F followed a different pattern entirely. She opened a second database, one she had been building for 3 years, a cross-reference of patient identifiers, ward assignments, and research protocols. The hospital had been heavily involved in medical research since the early 1900s. Many of those studies were published, some were not, and some existed only in fragments, scattered mentions in faculty correspondence or budget reports. She entered 47F into the search field. 3 results. 2 were archived research protocols from the Department of Obstetrics and Gynecology. The third was a letter from a department head to the hospital's board, dated 1929, requesting expanded funding for ongoing observational studies of postpartum complications in charity patients. Chen felt a cold certainty settle over her. She had seen this pattern before, in other archives, in other cities, research done on patients who had no idea they were research subjects. Trials conducted without consent, without explanation, without any mechanism for refusal. And all of it justified by the belief that medical progress required data, and that poor patients receiving charity care were obligated to provide that data in exchange for treatment. She needed to know who the woman in the photograph was. She needed to know what study she had been enrolled in, and she needed to understand what had actually happened in Ward D in April of 1927. Chen started with the photographer. Hartman & Sons had been a successful commercial studio in downtown Baltimore through the 1930s. Their client list included hospitals, schools, businesses, and wealthy families. The studio's ledgers, donated to the Maryland Historical Society after the business closed, listed dozens of shoots at this hospital between 1925 and 1930. Most were routine, new equipment, staff portraits, building exteriors. But the entry for April 1927 noted Ward D, Patient Care Series, 8 exposures, invoice to Dr. Howard Weston, Department of Obstetrics. Dr. Howard Weston. Chen pulled up the hospital's faculty records. Weston had been an associate professor and attending physician from 1923 to 1931. His published work focused on puerperal fever and postpartum hemorrhage. He had co-authored papers in several medical journals, most of them describing large cohort studies conducted at this hospital. One paper from 1928, published in the American Journal of Obstetrics and Gynecology, thanked the hospital administration for access to clinical material and noted that the study included observations of 160 women admitted for childbirth complications over a 2-year period. Clinical material, not patients. Material. She contacted Dr. Paul Reeves, a historian of medicine at Johns Hopkins, who specialized in early 20th century research ethics. They had worked together on a previous project about tuberculosis sanatoriums. She sent him the photograph, the reference number, and what she had found so far. Reeves called her the next afternoon. His voice was careful. "You know what this is, right?" "I have a guess," Chen said. Observational studies in obstetrics wards were common in the 20s, Reeves said. Most teaching hospitals did them. Women admitted for complications, childbirth injuries, infections, they became part of ongoing data collection. The justification was that they were receiving free or low-cost care, so participation was implied. No one asked permission, no one explained what was being recorded or why. And the women were usually poor, often immigrants, often black. The assumption was that they would not understand, or that they had no right to refuse. Were these studies ever beneficial? Chen asked. Some of them advanced medical knowledge, yes, but the methods were exploitative. And some of these observational studies were covers for more invasive experiments, testing new drugs, new surgical techniques, observing outcomes without intervening when intervention was possible, all in the name of learning. He paused. If that clipboard says what you think it says, that woman was not being treated as a patient. She was being treated as data. Chen thanked him and hung up. She went back to the archives catalog and searched for anything related to Weston's research. She found budget reports, correspondence with pharmaceutical companies, and a set of patient logs labeled Ward D Research Cohort 1925 to 1929. The logs were sparse. Each entry had a number, a date of admission, a brief note about diagnosis, and a notation about outcome. Recovered, transferred, deceased. The numbers ran from 1F to 89F. She found 47F, admitted April 14, 1927. Diagnosis, postpartum hemorrhage. Outcome, recovered, discharged April 28, 14 days. A long stay for recovery from hemorrhage, unless something else had been happening. Chen cross-referenced the date with the hospital's general admission records. The woman's name was listed as Sarah Coleman, age 23, address in East Baltimore, Occupation listed as domestic worker. Admitted after a home birth that had gone wrong. The midwife had brought her in when the bleeding would not stop. Chen found Sarah Coleman in the 1930 census. She was living with her mother and 2 children, working as a laundress. The census also listed her as literate, able to read and write. That detail mattered. Whatever had been done to her, whatever study she had been enrolled in, she could have understood an explanation if anyone had bothered to give her one. Chen needed to understand the larger system. She reached out to Dr. Lydia Grant, a public health researcher who had published extensively on medical experimentation in the Jim Crow South. Grant agreed to meet her at a coffee shop near the hospital. Chen brought copies of the photograph, the research logs, and Weston's publications. Grant studied the photograph for a long time. Then she looked up at Chen. "Do you know where Ward D was located in the hospital?" "East Wing, 3rd floor," Chen said. "Why?" "That was the charity ward, almost entirely black and immigrant patients. The private maternity ward was on the west side, entirely white and middle class, 2 completely separate systems operating in the same building." Grant tapped the photograph. This woman was not there by choice. She came in bleeding and desperate, and the hospital enrolled her in a study without her knowledge, and then they took her picture to show how compassionate they were. Grant explained that medical research in the 1920s operated with virtually no oversight. The concept of informed consent did not exist in any formal sense. Patients, especially poor patients, were seen as obligations to the institution. If you received charity care, you were expected to contribute to the institution's mission, and that mission included research. Obstetrics was a particularly exploitative field because women in labor or recovering from childbirth were vulnerable, often in pain, sometimes frightened for their lives. They trusted the physicians and nurses because they had no other choice. These studies collected data on everything, Grant continued: vital signs, symptoms, responses to different treatments or non-treatments. Some studies intentionally withheld interventions to see what would happen naturally. Others tested experimental drugs, and because there was no requirement to disclose, women never knew which group they were in. They thought they were being cared for. They had no idea they were being watched. Chen asked about the nurse in the photograph. Grant studied the image again. She was part of the system. Nurses were trained to follow physician orders without question. If Weston told her to pose for this photograph and to present this patient as a routine case, she would have done it. But she also might have known exactly what was happening and felt powerless to do anything about it. Or she might have believed the justification she was given, that this work was for the greater good. Chen went back to the archive and pulled every record related to Ward D between 1925 and 1930. She found procurement records for experimental medications, correspondence with pharmaceutical sales representatives, and internal memos about staffing for observational protocols. One memo from a head nurse to the ward supervisor expressed concern that some patients were asking questions about why they were being examined so frequently and why medical students were always present. The supervisor's response, written in the margin, was brief: "Refer all questions to attending physician. Do not engage." She found death records, too. Between 1925 and 1929, 42 women admitted to Ward D died during their stay. Some deaths were listed as expected, complications from severe hemorrhage or infection, but others were noted as sudden deterioration or unexpected outcome. And in at least 6 cases, the death occurred days after the patient had been noted as recovering. One of those deaths was a woman named Ruth Parker, admitted in March 1927, 1 month before Sarah Coleman's admission. Parker had been admitted with a uterine infection after childbirth. The research log noted she was enrolled in 39F, an observational study of antibiotic response. The log tracked her temperature and pulse every 6 hours for 5 days. On the 6th day, her condition was noted as worsening. On the 7th day, she died. No intervention was recorded, no change in treatment, just observation. Chen requested Parker's full medical chart from the hospital's off-site records facility. When it arrived 3 weeks later, she found a note written by a junior physician, dated 2 days before Parker's death. Patient shows signs of sepsis. Recommend immediate surgical intervention. Below it, in different handwriting, intervention not consistent with protocol, continue observation. Someone had decided that learning was more important than saving Ruth Parker's life. Chen knew she had to present this to the hospital's administration. The institution had rebranded itself multiple times over the decades, emphasizing its commitment to community health and ethical care. It had a bioethics institute, it had diversity initiatives, it prided itself on transparency, but it had never fully reckoned with this chapter of its history. The promotional photographs from the 1920s were still sometimes used in anniversary publications, cropped and contextualized as evidence of the hospital's long tradition of service. No one had looked closely at what those images actually showed. She requested a meeting with Dr. Thomas Osterholm, the hospital's chief medical historian and director of archives. She brought the photograph, the research logs, and the records of the women who had died. Osterholm listened without interrupting. When she finished, he sat quietly for a moment. "This is going to be a problem," he said finally. "It already is a problem," Chen said. "It has been a problem since 1927. We just have not acknowledged it." Osterholm explained that the hospital was in the middle of a major capital campaign. Donors were being courted for a new research wing. The marketing team had been preparing materials that highlighted the hospital's long history of medical innovation. Any public acknowledgement of unethical research from the past could complicate those efforts. Board members would be concerned about liability, about public perception, about whether this would open the institution up to criticism or legal action. Chen understood the institutional logic, but she also understood that the photograph and the records were not going away. If we do not tell this story honestly, someone else will, and it will be much worse for the hospital if it looks like we were hiding it. Osterholm agreed to bring the matter to the hospital's ethics committee. The meeting was scheduled for 6 weeks later. Chen was invited to present her findings. She spent those 6 weeks building the most complete picture she could. She found Sarah Coleman's descendants through genealogical records. The family still lived in Baltimore. She reached out carefully, explaining what she had found and asking if they knew anything about Sarah's time in the hospital. Sarah's great-granddaughter, a woman named Monica Terrell, agreed to meet with her. Terrell brought a small box of family papers. Among them was a letter Sarah had written to her mother in 1928, a year after her hospital stay. In it, Sarah mentioned that she still had nightmares about the hospital, about feeling watched constantly, about doctors who never explained what they were doing or why. She wrote that she had asked the nurses questions, and they had told her to be grateful for the care she was receiving. She wrote that when she left, she felt like she had been used but could not explain how or why. She never talked about it out loud, Terrell said, but she wrote it down. I think she wanted someone to know. Chen returned to Reeves and Grant with what she had found. They helped her prepare a formal presentation for the ethics committee. The presentation included the photograph, the research logs, the death records, Sarah's letter, and a broader historical context about medical exploitation in the 1920s. They framed it not as an exposé, but as an opportunity for the hospital to lead by example in confronting its past. The ethics committee meeting took place in a conference room on the hospital's executive floor. 15 people attended: physicians, administrators, board members, legal counsel, and representatives from the hospital's public relations team. Chen presented for 40 minutes. When she finished, the room was silent. Then the questions started. Were these practices illegal at the time? No, Chen explained, because there were no laws regulating medical research. Did other hospitals do the same thing? Yes, it was common practice. Are there living victims who might sue? Unlikely, given the time elapsed. Could this hurt the capital campaign? Possibly. One board member, a retired surgeon, asked a different question. What do you think we should do? Chen had prepared for this. I think we should tell the truth, publicly. I think we should build an exhibit around this photograph and others like it. I think we should acknowledge that this hospital participated in a system that treated poor women as experimental subjects without their consent. I think we should invite descendants of those women to help us tell the story. And I think we should make clear that this is not just history. This is about how medical institutions build trust or break it. The public relations director spoke up. This could damage our reputation. Our reputation is already damaged, Chen said. We just have not admitted it yet, and every day we do not admit it, we are lying by omission. The committee voted. It was not unanimous, but it was decisive. The hospital would move forward with a public acknowledgement. They would commission a formal historical study, create an exhibit, and reach out to descendants of the patients who had been exploited. They would also establish a new review process for archival materials used in promotional contexts to ensure that historical images were not sanitized or misrepresented. The exhibit opened 14 months later in the hospital's main lobby. It was titled Ward D, Medical Research and the Exploitation of Vulnerable Patients, 1925 to 1930. The 1927 photograph was the centerpiece, displayed at large scale with the clipboard detail magnified beside it. Panels explained what research protocols were, how they operated without consent, and who was targeted. A video installation featured Monica Terrell reading Sarah Coleman's letter aloud. Another section listed the names of the 42 women who died in Ward D during the research period, as many as could be identified from surviving records. The exhibit also included a timeline showing the development of medical ethics standards, the Nuremberg Code in 1947, the Declaration of Helsinki in 1964, the Belmont Report in 1979. It made clear that these protections did not emerge naturally. They were responses to abuses, to experiments that treated human beings as material. The opening drew a large crowd. Descendants of other patients came forward with their own family stories. One woman brought her grandmother's discharge papers, which included a notation about research participation that no one in the family had understood. Retired nurse who had worked at the hospital in the 1960s shared that she had once been told by an older colleague that Ward D had a dark reputation, that nurses who worked there in the old days did not like to talk about it. The hospital's CEO spoke at the opening. He acknowledged that the institution had failed in its duty to protect vulnerable patients. He apologized to the descendants and to the community. He committed to ongoing transparency in how the hospital presented its history. He also announced a new endowment fund named for Sarah Coleman and Ruth Parker to support research ethics training for medical students and residents. Not everyone was satisfied. Some community activists argued that an exhibit was not enough, that the hospital needed to provide material reparations to descendants. Some physicians worried that the focus on past harms would undermine trust in current medical research, which operated under strict ethical guidelines. Some donors did express concern about the capital campaign, but the fundraising continued, and the research wing was eventually built, and the exhibit remained in place. Chen stood in front of the photograph during the opening reception. She watched visitors stop, read the panels, look closely at the clipboard. Some took pictures. Some stood silently for a long time. A few cried. Monica Terrell stood beside her. "My great-grandmother never knew why she felt the way she did about that place," Terrell said quietly. "But she knew something was wrong. She just did not have the words for it. Now she has the words." Chen thought about all the other photographs still sitting in archives and family albums and museum storage rooms, images that look harmless or nostalgic or even inspiring, until you notice the small detail that should not be there, the hand positioned wrong, the expression that doesn't match, the object in the background that tells a different story than the one the photographer intended. Every photograph is a piece of evidence. Every portrait is a document of power. Who is centered, who is pushed to the edges, who is missing entirely, these are not accidents. They are choices. And when those choices involve exploitation or violence, the photographs become records of that harm, whether the people who staged them intended it or not. Hospitals took photographs to prove their modernity. But modernity does not mean justice. Progress does not mean care. And compassion documented in a photograph is not the same as compassion practiced in a ward. The photograph of the nurse and patient in Ward D is still in the hospital's collection, but now it is labeled accurately. Research subject, not patient. Exploitation, not care. A public relations image that accidentally told the truth, and in telling that truth, it gives back something to the woman in the bed, something that was taken from her 97 years ago. Not consent, because that can never be retroactively given, but acknowledgement. The recognition that what was done to her was wrong, and that her experience matters, and that the institution that used her now has an obligation to remember. That photograph hangs in the lobby now, large and impossible to miss. Every person who walks through those doors sees it, and some of them stop and look closely and notice the clipboard. And when they do, they are seeing what hospitals tried to hide for decades. That beneath the clean uniforms and the modern equipment and the language of progress, there was a system that treated poor women as objects to be studied, recorded, and forgotten. Until someone looked closely enough to see what the photograph had been trying to say all along.